Hello and welcome to Preparations for Home Care After Hospitalization. My name is Cheryl Kostis and I'm a registered nurse with the University of California, San Diego Medical Center. I am a nurse surgical specialist for the Morris Cancer Center. And what I will be covering is what information you will need to know before you go to the hospital, preparations and information you will need to have during your hospitalization, and preparations you will need to have for coming home. What I'd like to do is give you a list of questions that you will need to ask your healthcare team before you go to the hospital. This list of questions will be available for you on our website, so you don't need to take notes. You can print the notes afterward. The first question you will need to know is, what is the name of the surgery or the procedure that is being done? Before procedures and operations, you will need to sign a piece of paper which is called a consent for the procedure or for the operation. Be sure to ask a copy of this for your records and be sure you understand what the operation entails, what is going to be done, and what is important for you to know. Another question that you should ask is, has my insurance been notified and the authorization for payment for this hospitalization or procedure been received? It's important to have this all covered before you're in the hospital. Many insurance companies require 1 day, 2 day, and some a week's notice before they will cover the cost of these procedures. What's really important for you to ask is, how long do you expect me to be in the hospital? You will need this information so you can properly plan for childcare, for your work. What do you need to prepare for? Maybe you need to stop your mail. Maybe you will need your animals taken care of. So be sure you find out, how long do they think you will be in the hospital? Also, it's important to know, what is the expected recovery time? When can you go back? When can you resume work? When can you resume your normal activities? Be sure and ask these questions. Sometimes procedures only last a day. Sometimes hospitalizations can be overnight, 2 days, 3 days, or 4 days. Be sure you have it clear and you understand when you are expected to go home. When you're talking about your recovery time, you're going to want to know, when can I resume my normal duties, my activities, and my work? You might have childcare to arrange for. You may have a very difficult job that requires heavy lifting and work, and you're going to want to know so you can tell your boss and make proper arrangements so when you can go back to what you normally do in your normal life. But when you go home and when you go back to work, be sure to ask, will I have any restrictions? They might tell you, you can go back to work in 2 weeks, but don't lift. Don't climb stairs. Don't sit too long. Don't stand too long. So be sure it's very clear to you that you know if you have any limitations or any restrictions once you get home or you return back to work or your normal activities. What's very important to have, and be sure you have it in writing, what change in medications will I need to make and when should I make them? Oftentimes before surgery or a procedure, the physician will ask you to stop taking certain medication. What's important to know is, if you take aspirin, do you need to stop aspirin? And how often before the operation do you need to stop taking it? Also, there are some medications for high blood pressure, for diabetes, for kidney disease. All of these need to be very carefully regulated and scheduled so you know when to take them and when not to take them. So be sure you get that clarified. Also, what's important to ask is, what change in diet do I need to make and when do I need to make the change? For some procedures and for some operations, they don't want you eating for 2, 4, possibly 12 or 24 hours before the procedure or the operation. Oftentimes, they'll tell you to be on a special diet for a day or two. Maybe that would include just liquids that are clear, such as just water, just broth, just apple or cranberry juice, no solid foods. Be sure you get that clear too if there's any change in your diet. If you're a diabetic, as you know, it's important to have your diet, your diabetic medicine, possibly your insulin, all regulated before you do make these diet changes. So now you're in the hospital. What questions do you need to ask your healthcare team while you're in the hospital? There will be many people taking care of you when you're in the hospital. Doctors, nurses, attendants, technicians, men and women from the laboratory department, from the x-ray department, people that bring you your food and your beverages, housekeepers. You'll come in contact with a number of people, so be sure to ask your questions of each member of your team that you might have. My first question would be, what are the visiting hours? I would want my family and friends to visit me while I am in the hospital, so be sure you find out. Can the family come anytime? Is it limited to how many? Is there an age restriction? I mean, I'd like my daughter to come and visit me, and she's only 12 years old. So be sure you ask, are there any limits as to the age or the number of people that you'd like to visit you? My second question would be, how do I work the nurse call button? If I need help, I need to know how to get it. Also let them know that you have limitations. If they talk to you on a speaker over the phone, you're not going to be able to hear that. So be sure you know how you can call them and then how they can best communicate with you. Be sure you ask, what are the medications I am getting? There'll be a change in your medication. You want to make sure they know if you have an allergy and you don't want to get that medication. So when your nurse or your health care member comes in the room, say, what medication am I getting, please? You don't want any mistakes, and you're your best first safety, being in the hospital and knowing what medication they're giving to you. My next question would be, when can I get out of bed? I'm not a person that likes to stay in bed, but there might be restrictions on that. They might say, nope, you need to stay in bed for a day or two, or you need to have your arm raised on a pillow, or maybe your leg has to be still for a while. So be sure you find out when can you get out of bed, and when you do, are there any special care needs that need to be taken for you? And